So, hello students. Now, let us come to a very, very important topic from the MCQ point of view, the muscles of mastication. Muscles of mastication and the nerve supply, the actions of the muscles of mastication, right? Now, we already have we have discussed, you know, uh, we know the muscles of mastication. Come on, students. Can anyone tell me the muscles of mastication? Four muscles. The muscle here, which lies, what is this fossa? Temporal fossa, the muscle which lies here. Temporalis, perfect. The muscle which begins from the zygomatic arch comes and gets inserted on the angle of the mandible. What's that? Masseter, excellent, very good, very good, very good. So let us understand this muscles of mastication. Here, have a look at this muscle. The muscle which begins from the temporal fossa here, and the muscle which comes down and gets inserted into. Okay, come on, students. You tell me. That's the ramus of the mandible. What is this and what is this for the ramus? That's the angle and that's the body of the mandible. That's the body. That's the ramus. That's the angle of the mandible. Correct? What is this process? That's the coronoid process. That's the coronoid process. And what is this process for the mandible? Condyloid process. Condyloid process is also known as the head of the mandible, head. So coronoid process and condyloid process. Condyloid process is also known as the head of the mandible, head. And what is this part of the mandible known as neck of the mandible, neck. So that part is the neck. So coronoid process, condyloid process, or the head of the mandible, that's the neck of the mandible, that's the ramus, that's the body, this is the angle of the mandible. That's the angle of the mandible, correct? So, a muscle which begins from the temporal fossa, a muscle which comes down and gets inserted on the coronoid process and the ramus of the mandible here. What is this big muscle? Temporalis. That's the temporalis, right? So, origin of temporalis from the temporal fossa, insertion is into the coronoid process and the ramus of the mandible. Now, you tell me, students, when this muscle contracts, what is it going to do? Now, these are the vertical fibers. These are the anterior fibers or the vertical fibers of temporalis. When they contract, they're going to take the mandible up, like this. What is this? Elevation of the mandible. So these muscles of mastication are going to elevate the mandible. They're going to elevate the mandible, right? So these are the actions of temporalis. The vertical fibers or the anterior fibers, they're going to take the mandible up. Now look at this fiber, students. Look at this fiber. Specifically, these fibers are coming from backside like this, and they come and get inserted on the coronoid process. They're coming from behind. So when they contract, they're going to pull the mandible backwards, right? They're going to pull the mandible back. What is this? Retraction. Yes, very good. That's retraction of mandible. So what is the action of temporalis? One is elevation of mandible, and the second one, the posterior fibers, they do retraction of mandible. Am I clear to all of you? Right? What is the nerve supply of temporalis? Anyone? What's the nerve supply of temporalis? So I'll just mention this as temporalis. Temporalis. There are two types of fibers, anterior fibers or the vertical fibers and the posterior fibers. Anterior fibers, they do what? Elevation of the mandible. Elevation of the mandible, and the posterior fibers cause retraction of the mandible. Retraction. Perfect. Now, what is the nerve supply of temporalis? We know this, students. We have seen this. Come on. Anyone? Anyone? Yes. What did you answer? Posterior division. No. It's mandibular nerve. That's correct. But which division of mandibular nerve? Anterior division. What is the name of the branch? Deep temporal nerves. Very good. Very good. So deep temporal nerve, which is a branch of anterior division of mandibular nerve. So that's about temporalis. Perfect. So we're discussing the muscles of mastication. The first muscle that we've discussed is the temporalis. Begins from the temporal fossa, gets inserted into the coronoid process and the ramus of the mandible. The vertical fibers or the anterior fibers, they do elevation. The posterior fibers, they do retraction of mandible. Perfect. Very good. Now, coming to the next muscle. A muscle which begins from the zygomatic arch. A muscle which comes and gets inserted on the angle of the mandible. Angle, but outside. Simple. Muscle begins from the zygomatic arch, comes and gets inserted on the angle outside. This muscle is the masseter muscle. So when this masseter muscle is going to contract, it is going to pull the mandible up like this. What is this? Action, elevation of mandible, elevation. So action of masseter is going to be elevation of mandible. Clear? So that's temporalis that we've written. Masseter, I'll write it here. Masseter. Masseter does what? Elevation. Elevation of mandible. Clear? So masseter does elevation of mandible. Simple. What is the nerve supply of masseter? Masseteric nerve, which is a branch of anterior division of mandibular nerve. Masseteric nerve, which is a branch of anterior division of mandibular nerve. So that's about the masseter temporalis. Easy. Masseter and temporalis are easy. Now, which are the other two muscles of mastication? The other two muscles, yes, you know this. Yes, very good. Yeah, the medial and the lateral pterygoids. Very good. The medial and the lateral pterygoids, but where do they lie? Come on, you can answer this. We've seen this. Where does the medial and the lateral pterygoid lie? We can't see them. We have to remove the ramus. That means where do we go? We remove the ramus of the mandible. We go deep to the ramus. That means we are in the infratemporal fossa. And these two muscles of mastication, the medial and the lateral pterygoids, they lie in the infratemporal fossa. We've already seen this, students. We've already seen this, right? Look at this beautiful slide. So we've removed the ramus here. That's the lateral pterygoid and that's the medial pterygoid. Perfect. Now, this is slightly difficult to understand, students. There's some mixing of the muscles here. Just try to understand. I'll draw a slide for you. I'll make it easy for you. Don't worry. Okay. Have a look at this slide now. I'll make it like this. So that's the pterygoid plate. I mean, that's the base of the skull, the greater wing of sphenoid. That's the pterygoid plate. This is the lateral pterygoid plate. That's the lateral pterygoid plate. Lateral pterygoid plate. And who's in front of this lateral pterygoid plate? What is the... Okay, I'll just clear this. What is this in front of the lateral pterygoid plate? What is this? That's the maxilla. Maxilla, right? That's a maxilla bone. That's the lateral. I'll write it here only. Lateral pterygoid plate. Lateral pterygoid plate. That's the base of the skull. That's the greater wing of sphenoid or the base of the skull. That's the lateral pterygoid plate. This is the maxilla. What is this fossa? Come on, students. What is this fossa? Between the lateral pterygoid plate and the maxilla, the fossa that we get is the What's that? Pterygopalatine fossa. Have I not told you this? Pterygopalatine fossa. Well, I told you we are in the infratemporal fossa. We look laterally. Who's that? The ramus of the mandible. We look medially. Who's that? The pterygopalatine fossa. And who lies in this pterygopalatine fossa? The pterygopalatine ganglion, the third part of maxillary artery, enters into the pterygopalatine fossa. This you know. Fine. So that's the maxilla. That's the lateral pterygoid plate. That's the base of the skull. Fine. Let us understand this now. Understand this lateral pterygoid muscle. The lateral pterygoid muscle has got two heads. The upper head begins from here, begins from the sphenoid bone. The upper head begins from the sphenoid bone. The lower head begins from the lateral pterygoid plate. The lower head begins from the lateral pterygoid plate. The upper head begins from the sphenoid bone. The lower head begins from the lateral pterygoid plate. Now, where is this muscle inserted on? This muscle is inserted on, how to make this? That's the condyloid process. That's the neck of the mandible. That's the condyloid process. That's the neck of the mandible. That's the coronoid process. That's the ramus of the mandible. That's the angle of the mandible, right? So where is the insertion of lateral pterygoid? The insertion of lateral pterygoid is into the neck of the mandible. Neck. It's into the neck of the mandible. On the neck of the mandible here, there's a fossa. On the neck of the mandible, there's a fossa here. What is this? What is this fovea? A fossa. A fossa on the inner aspect of the neck of the mandible. This is what we call as the pterygoid fovea. There's a small depression here on the inner aspect of the neck of the mandible, and this is what we call as pterygoid fovea. pterygoid fovea, right? So this pterygoid fovea is present on the inner aspect of the neck of the mandible. This pterygoid fovea receives the insertion of lateral pterygoid muscle. Now, this lateral pterygoid has got two heads. What do we call this head as? This is what we call as the upper head of lateral pterygoid, and this is what we call as the lower head of lateral pterygoid. The upper head of lateral pterygoid begins from the greater wing of sphenoid. The lower head of lateral pterygoid begins from the lateral aspect of the lateral pterygoid plate. Lateral surface, you say, of the lateral pterygoid plate. That's also fine. Lateral surface of the lateral pterygoid plate. Clear? Okay. See, if this diagram is not up to the mark, I'll just draw this once again for you. Understand this. Okay. One moment. I'll draw it like this. I will have to make it like this. This is the upper head of lateral pterygoid, and that's the lower head of lateral pterygoid. Upper head and lower head, like this. Upper head and lower head, they go together. They go together and they get inserted on the neck of the mandible. That would be the neck of the mandible, like that. Clear? So these are the two heads of lateral pterygoid, like this. This is the upper head, and that's the lower head of lateral pterygoid inserted into the neck of the mandible. Have a look at the slide. Slightly difficult for me to draw. So what is this? This is the lateral pterygoid muscle. Clear? What is this head of the lateral pterygoid? Upper head, that's the lower head of lateral pterygoid. Upper head begins from the base of the sphenoid bone. The lower head begins from the lateral aspect of the lateral pterygoid plate. And both these heads come together, get inserted into the pterygoid fovea on the medial aspect of the neck of the mandible. Clear? Now you tell me, students, when this head of lateral pterygoid contracts, look, when this head of lateral pterygoid contracts, see, when a muscle contracts, it always brings its insertion close to its origin. This is the origin, that's the insertion. So when a muscle contracts, it will bring its insertion close to its origin. So what is it going to do? The lower head of lateral pterygoid, when it contracts, it does this. What's this? Protrusion of mandible. Protrusion. You remember the posterior fibers of temporalis were taking the mandible back. That was retraction. The lower head of lateral pterygoid pulls the mandible in front. We call this as protrusion of mandible. And the upper head of lateral pterygoid, when it contracts upwards, the jaw goes down. The jaw goes down. When the upper head of lateral pterygoid, it contracts upwards, the jaw goes down. That's depression of the mandible. Depression. So lateral pterygoid has got two heads, upper head, lower head. Upper head does depression of the mandible. The lower head does protrusion of mandible. Remember, students, all the muscles of mastication, they cause elevation except lateral pterygoid, the upper head of lateral pterygoid, which causes depression of the mandible. It is slightly, is it difficult? You tell me. Look at this slide once again. So what is this head of that's the lateral pterygoid. So that's the upper head of lateral pterygoid. That's the lower head of lateral pterygoid. Okay, upper and lower head of lateral pterygoid, and inserted into the pterygoid fovea of the neck of the mandible. What is this joint, bacho? What is this joint? That's the TM joint. That's a TM joint. And what is this within the TM joint? Can anyone tell me what is this within the TM joint? Have a look at that slide. That's the articular disc. You can see this. That's the articular disc of TM joint, and the articular disc of TM joint is a degenerated part of lateral pterygoid. That's a very important MCQ. You can see this. The articular disc of TM joint, that's actually a degenerated part of lateral pterygoid. It's a degenerated part of lateral pterygoid. Perfect. Are you able to follow? Now, this lower head of lateral pterygoid is going to pull the mandible forwards. That's protrusion. And the upper head, when it contracts upwards, the jaw goes down. That's depression of mandible. Depression. Perfect. Are you able to follow this, students? Look at this. Look at this slide. What is this view? This is a view from back side. You're looking from back. So what is this muscle? That's a lateral pterygoid. And what is this? Medial pterygoid. Lateral and medial pterygoid. Clear to all of you? Is this clear to all of you? So what is this head? Once again, what is this head of lateral pterygoid? Upper head. And what is this head of lateral pterygoid? That's a lower head. Lower head does protrusion, upper head does depression of the mandible. Clear? Now, let me tell you the medial pterygoid once, then we'll write about this. So medial pterygoid has two heads. Medial pterygoid has two heads. One head begins from, what is this plate? Lateral pterygoid plate. What is the surface of the lateral pterygoid plate that you're looking at? This is the lateral surface of lateral pterygoid plate. The lateral pterygoid plate will have a surface inside. That's the medial surface of the lateral pterygoid plate. And this medial surface of the lateral pterygoid plate gives origin to a muscle. Now, this is deep to the lateral pterygoid. What is this? This is the inner surface of the lateral pterygoid plate gives origin to, or the medial surface of the lateral pterygoid plate gives origin to the medial pterygoid. That's a medial pterygoid muscle. This is what we call as the deep head of medial pterygoid. So the deep head of medial pterygoid arises from the medial aspect of the lateral pterygoid plate. And what is this head of medial pterygoid, which arises from maxilla? This is the superficial head of medial pterygoid. Just try to understand this. That's the superficial head of medial pterygoid, which arises from the maxilla. That's a deep head of medial pterygoid. And where is it inserted? On the angle, but inside. So the superficial head of medial pterygoid arises from maxilla. This is clear. The deep head of medial pterygoid arises from the medial aspect of lateral pterygoid plate. So, see, if I make it like this, this is the superficial head of medial pterygoid, and that's the deep head of medial pterygoid. There's one muscle which is between them. Can anyone tell me there's one muscle which is between the two heads of the medial pterygoid? This is the upper head of lateral pterygoid. This is the lower head of lateral pterygoid. This is the deep head of medial pterygoid, and that's the superficial head of medial pterygoid. So one muscle is between the two muscles, or the lower head of lateral pterygoid is between the two heads of medial pterygoid. Are you following this? The lower head of lateral pterygoid is between the medial and the between the superficial and deep heads of medial pterygoid. Between the superficial and deep heads of medial pterygoid. I hope you are able to follow this, students. Look at this now. Look at this slide. Look at this slide. It will be clear. So, students, what is this head of lateral pterygoid? Lower head of lateral pterygoid. What is this head of medial pterygoid? That's a superficial head. That's a deep head of medial pterygoid. So the lower head of lateral pterygoid is between the two heads of medial pterygoid, and the medial pterygoid comes and gets inserted on the angle, but inside, on the inner aspect of angle. Who's the muscle here? On the outer side, on the outer aspect of the angle here, that's a masseter. That's a masseter. Look at this slide, another very good slide. Look at this. So what is this? Number one, that's the superficial head of medial pterygoid. Number two is the deep head of medial pterygoid. And who's this? Number three, the lower head of lateral pterygoid. So the lower head of lateral pterygoid is between the two heads of medial pterygoid. And number four is upper head of lateral pterygoid. Upper head of lateral pterygoid. Clear? This is superficial head of medial pterygoid. That's a deep head of medial pterygoid, lower head of lateral pterygoid, upper head of lateral pterygoid. I hope this is clear to all of you. You can see this: upper head of lateral pterygoid, lower head of lateral pterygoid, superficial head of medial pterygoid, deep head of medial pterygoid. Okay, so I hope this is clear to all of you. I am clear now? The superficial, okay, we'll just write this down so it will be clear to you. So starting with lateral pterygoid, lateral pterygoid. Okay, there are two heads. One is the upper head, and the lower head. Upper and lower head. Upper head arises from sphenoid bone. Sphenoid bone. Just remember this much. Upper head arises from the greater wing of sphenoid. That's fine. Lower head arises from lateral aspect of lateral pterygoid plate. Lateral aspect of the lateral pterygoid plate. Clear? Where are these two heads inserted on? These two heads come together. These two heads are inserted on pterygoid fovea. Pterygoid fovea. And where's pterygoid fovea? on the neck of the mandible. It is on the neck of the mandible. Pterygoid fovea, that's on the neck of the mandible. Clear? The lower head, one more point, the lower head lies between the lower head of lateral pterygoid lies between the superficial and deep heads. The superficial and deep head of medial pterygoid. Superficial and deep head of medial pterygoid. Students, you're getting oriented to this now. This is slightly complicated. Only this part is slightly complicated, difficult. The rest, everything is easy. So the lower head of lateral pterygoid lies between the two heads of medial pterygoid, the superficial and deep head of medial pterygoid. Fine. What is the action of the upper head? Upper head, what is the action? It does depression. Depression of the mandible. Depression of the mandible. And the lower head does protrusion of mandible. Protrusion. So lower head does protrusion, upper head does depression of the mandible. I hope I'm clear to all of you. Okay, so that's about the lateral pterygoid. Coming to the medial pterygoid. Medial pterygoid. Medial pterygoid, again two heads, superficial and deep. Superficial head arises from maxilla. The deep head arises from the medial aspect of lateral pterygoid plate. Medial aspect of the lateral pterygoid plate. Where are these two heads inserted on angle on the medial side? Medial side of the angle of mandible. Clear? On the lateral side is masseter. Clear to all of you? Okay, these two heads are going to enclose the lower head of lateral pterygoid. What is the action of all this? Action of the medial and the lateral pterygoids? Action is elevation. Elevation of the mandible. Elevation. Clear to all of you? Look at this. Okay, sorry. Look at this slide. Look now. The medial pterygoid gets inserted on the angle, but inside. So when these two heads contract, what are they going to do? They're going to pull the mandible up. So what is that? Elevation of the mandible. Fine, students. Clear to all of you? So we have studied the muscles of mastication. There are 4 muscles of mastication: the temporalis, masseter, medial and lateral pterygoids. Temporalis begins from the temporal fossa, inserted on the coronoid process and the ramus. Actions of temporalis: the straight fibers, the vertical fibers, they cause elevation. The posterior fibers, they cause retraction of mandible. Nerve supply of temporalis: the deep temporal nerve, which is a branch of anterior division of mandibular nerve. That's temporalis. Coming to the masseter, begins from the zygomatic arch, inserted on the angle outside. Action: elevation of mandible. Nerve supply: masseteric nerve, which is a branch of anterior division of mandibular nerve. Clear? Coming to the lateral pterygoid, 2 heads, upper head, lower head. Upper head begins from the sphenoid bone. Lower head begins from the lateral surface of lateral pterygoid plate. Both the heads come back, gets inserted on the pterygoid fovea in the neck of the mandible, which is on the medial side. Action: upper head, it causes depression of the mandible. The lower head does protrusion of the mandible. Nerve supply, that's the nerve to lateral pterygoid, which is a branch of anterior division of mandibular nerve. Finally, medial pterygoid. The superficial head begins from the maxilla. The deep head begins from the medial aspect of the lateral pterygoid plate. Both the heads gets inserted on the medial aspect of angle. Action: elevation of mandible. Nerve supply. Come on, students. Can anyone tell me the nerve supply of medial pterygoid? Yes, what are you saying? Anterior division. No. It's not anterior division. Anyone else? Anyone else? Any guesses? Any guesses? It is mandibular nerve. No doubt about it. Yes, it is mandibular nerve, but it is from the trunk of the mandibular nerve. Have I not told you this, students? Nerve to medial pterygoid arises from the trunk of the mandibular nerve, and this nerve to medial pterygoid supplies 2 muscles, 2 more muscles, the tensor palati and the tensor tympani. Perfect, students. Clear to all of you? Okay. So this is about the muscles of mastication. Um, Anything else? Okay, on this, look at this slide. On this, what is this muscle? Medial pterygoid. On the superficial head of medial pterygoid lies two nerves. What is this nerve here? That's the, yes, students, what is this nerve which lies on the medial pterygoid? That's the lingual nerve, which is related to the third molar tooth. Also, the inferior alveolar nerve lies on the medial pterygoid muscle, the lingual and the inferior alveolar nerves. What is this artery? That's a maxillary artery, which is divided into three parts by the lateral pterygoid muscle. Maxillary artery divided into three parts by lateral pterygoid muscle. Fine. What is this artery? Look, students, this is nice. What is this muscle here? That's a masseter here. Masseter. And what is this artery? What is this artery? Can anyone tell me? This artery emerges on the anterior border of masseter. We feel this artery on the anterior border of masseter. We tell the person to clench the teeth. And when a person clenches the teeth, the masseter becomes prominent on the anterior border of masseter. We feel for an artery here. Yes, facial artery. Very good. That's a facial artery. That's a facial artery. Perfect. Perfect. Very good. Students, I hope this muscles of mastication is clear to all of you. The actions of the muscle is clear to all of you. Come on, answer this MCQ. A clinical type of MCQ. 50 years old, 54 years old woman comes to the emergency department because of drooping of the left side of the face, difficulty in closing her eyes and chewing. During neurological examination, the physician asked her to open the jaw against resistance. Open the jaw against the resistance. Which of the following muscle is activated? Yes. So which is the muscle which helps in depression of the mandible or opening of jaw? That's the lateral pterygoid. Lateral pterygoid. Remember, students, all the muscles of mastications are going to do elevation of mandible except once again, the lateral pterygoid. Which head? The upper head does depression of the mandible. Depression. Is buccinator a muscle of mastication, students? Is buccinator a muscle of mastication? No. Buccinator is a muscle of facial expression. Remember, students, muscle of the face we divide into two groups. One is the muscle of facial expression. The second one is the muscle of mastication. Muscles of facial expressions are derived in the second pharyngeal arch. They are supplied by facial nerve. Whereas muscles of mastication are derived from the first pharyngeal arch. From the first pharyngeal arch, they are therefore supplied by which nerve? Mandibular nerve. Mandibular nerve. So buccinator is a muscle of facial expression. It is also known as a whistling muscle. That's the buccinator. What's the nerve supply of buccinator? The buccal branch of facial nerve. Whereas the muscles of mastication are derived from the first pharyngeal arch. The nerve supplying them is the mandibular nerve. And what was the branch of mandibular nerve with the name buccal? That's the buccal branch of mandibular nerve, but it is sensory. It supplies the skin over the buccinator. Supplies the skin over the buccinator. Clear, students? I hope this topic is clear to you. So these muscles of mastication are derived from the first pharyngeal arch, hence supplied by mandibular nerve, which is a nerve of the first arch. Also included in the first arch, muscles which are supplied by the mandibular nerve are, which are the muscles? The tensor palati, the tensor tympani, the mylohyoid, and the anterior belly of digastric. All these muscles are derived from the first arch. All these muscles are supplied by the mandibular nerve. The posterior belly of digastric is derived from the second pharyngeal arch. The nerve supplying it is therefore facial nerve. I keep on repeating this in every lecture, so students, you get a hang of it. You get the important MCQs there in your brain, right? Clear? Any doubts? Any doubts? I hope this lecture is clear to you, students. In case of doubts, you get back to me. Thank you to all of you for this patient listening. Thank you and happy learning.